My talk is about role of cardiac CT in heart failure. Basically, cardiac CT can be used in heart failure for assessment of cardiac function. It can be used for assessment of the underlying cause of heart failure, and it can also be used as a guidance for the treatment of heart failure. Like you see in this slide that you can very conveniently assess left ventricular systolic function with gated cardiac CT. You can assess LV end diastolic volume and systolic volume, ejection fraction, and even LA volume. Similarly, you can assess right ventricular volume and ejection fraction with gated cardiac CT. Today there was so much talk about LA. CT is also capable of assessing LA volume and LA function. Since you can see it contracting and relaxing, so you can measure various parameters of LA function. And previously people thought that use of CT is just limited to the assessment of systolic function. It has no role in the assessment of diastolic function. But theoretically it can be used for assessment of diastolic function as well. If you use the LV volume curve, then you can derive a first derivative curve from that curve, and that will tell you the rate of change of LV volume. And that rate of change of LV volume is actually the transmitral flow. So in this way, you can instantaneously measure mitral flow in all phases. And if you measure mitral area also with the CT, and you divide the flow by the mitral area, annulus area, then you will get the velocity. So indirectly you can measure all the parameters which you measure with the echocardiography. You can measure velocities and you can measure the flow rate. So you can have idea about diastolic function as well. And similarly, there's so much talk about the strain imaging with echocardiography. Echocardiography is an excellent tool and very commonly used for strain imaging. This is also possible with CT because you just want to detect the speckles or the dots, and you just want to see their motion in the gated images. When you see these with the cardiac CT, you can use it for assessment of myocardial strain in the same fashion as you do it with the echocardiography. Then the second purpose is to find out what is the underlying cause of heart failure. Like ischemic heart disease is very common cause of heart failure. Cardiomyopathies are second common cause of heart failure. LV non-compaction may be a cause of heart failure. Valvular disease is very important cause of heart failure. And congenital heart disease can also lead to heart failure. Like this is just to show you some examples of how it can be used. Like this is a case of ischemic heart disease with very severe coronary artery disease and very bad LV. You can see that there is global reduction of cardiac function, and there are regional wall motion abnormalities seen in this cardiac CT. There is thinning, wall motion abnormalities all seen in cardiac CT. This case of LV non-compaction, coronaries are just normal. You see hypertrabeculation in the LV, and that is actually the cause of heart failure symptoms in this patient. A small child with a congenital coronary anomaly, which is called Al-Kappa, that presented with heart failure at the age of just 1.5 years, and the patient underwent coronary artery bypass surgery for this. So this can also be detected very well with cardiac CT. Hypertrophic cardiomyopathy, very well defined, very well diagnosed with echocardiography and CMR. But though CT is not a primary tool for the diagnosis of cardiomyopathies, but if you are doing cardiac CT for some other reason, then this may be the complementary information in these cases. You can see the anatomical details, you can see the myocardial thickening, you can even measure the LV mass with cardiac CT, and you can also see if there is any obstruction in the LVOT. You can see mitral anterior motion. You can appreciate asymmetric septal hypertrophy. All these findings may be seen with cardiac CT as well. Similarly, other pathologies like subvalvular aortic membrane can be nicely seen with cardiac CT because of its very high spatial resolution. Here in this case, you see a subvalvular membrane just below the aortic valve. Other cases like cases of aortic regurgitation with dilated aortic root, with annulo-aortic ectasia, you can assess cardiac function, you can assess cardiac valve, you can assess the annulus, you can assess aortic root and the ascending aorta as well as the arch. The whole lot of information is provided by the cardiac CT in these cases. And a comprehensive examination is very helpful before proceeding for cardiac surgery for valve replacement. In patients with suspected aortic dissection, you can get very good information with cardiac CT. You can see the flap of the valve, and sometimes this flap may be prolapsing through the aortic valve into the LV and may be impairing the aortic function, and this can be very nicely seen with cardiac CT. And these patients may be cases of heart failure as well. Similarly, patients with dilated right-sided cardiac chambers presented with right-sided heart failure, you can use cardiac CT for evaluation of the underlying cause, like this case of an Epstein anomaly with distal displacement of the tricuspid valve and arterialization of the RV. Similarly, patient with cardiac arrhythmia, arrhythmogenic RV, and this can be seen with cardiac CT, the apical dyskinesia of RV with a clot and overall RV dysfunction. Similarly, patients with congenital heart disease like ASDs presenting with right-sided heart failure can be diagnosed with cardiac CT. Patients with anomalous pulmonary veins presenting with right-sided hypertension and heart failure can be diagnosed with cardiac CT. Patients with VSDs presenting with Eisenmenger complex can be diagnosed with cardiac CT. Patients with congenital anomalies like congenital corrected CCTGA, where RV is just acting like a systemic ventricle like LV, and LV is working as RV, can be seen with cardiac CT. This patient presented with heart failure in adult life. It was not known before. That patient had some coronary symptoms and was worked up for that, and it came out to be a case of CCTG. Similarly, other cases with like aortic stenosis with cardiac dysfunction can be diagnosed with cardiac CT with comprehensive evaluation of cardiac valve as well as cardiac function. Similarly, postoperative patients with valve dysfunction or paravalvular leaks can be seen with cardiac CT. Here you see a paravalvular leak just adjacent to the aortic valve. Similarly, cardiac CT is a good tool for planning of treatment. Like it is a mandatory tool for TAVI planning, for CRT planning, and for radiofrequency ablation for atrial fibrillation. In patients with coronary artery disease and questionable lesions, CT-FFR is very helpful for defining the significance of any lesion. The conventional FFR is the gold standard, but if you don't have that facility, then you can choose CT-FFR as an alternative. CT perfusion is also helpful in disputed cases, if in cases where you are not sure whether any lesion is significant or not. And then some vessels which are not properly visualized in conventional angiography. The totally occluded vessels, sometimes you just see the stump of the vessel and you don't know what is beyond that occlusion. And since in CT image you see the equilibrium image, whether it is the vessel has failed through retrograde or antegrade filling, it is visualized in cardiac CT. So it is a good tool in these cases also. CT-FFR is good tool for defining the significance of any lesion. Here is in this case the CTO lesion was defined very well with cardiac CT. In conventional angiography, you just see the stump of the vessel. You don't see what is beyond. But in the CT, you see very nice lumen of the LAD, and this was a good case for revascularization. Similarly, for TAVI planning, you give all the measurements of the aortic root, coronary ostial heights, and also you define the access for the TAVI procedure with CT. So it's a mandatory tool before TAVI procedure. Similarly, for CRT planning, you need to see the number of coronary veins and their location, and the cardiac CT is a good tool. In just normal CT exam, you can define the presence of the posterolateral coronary veins where you tend to place the left-sided lead for CRT. Similarly, for radiofrequency ablation, you need to have complete information about the pulmonary veins. And CT is used for defining their ostia, defining their number, defining their size, and then they can do the pulmonary vein isolation procedure with radiofrequency ablation. So it is a great tool before radiofrequency ablation for atrial fibrillation. Then it can be used for assessment of transplant recipients. After transplant, in patients with heart failure, after transplant, the coronary vasculopathy is something which is accelerated. And CT can be used as a tool for assessment of these vessels. You can see the transplanted heart with cardiac CT. Here you see the donor and the recipient heart both together. Similarly, if patient is on LVAD or assist devices, sometimes there is the thrombosis of these devices and there may be malfunctioning, patient may get desaturated, and you can study with cardiac CT. Here you can see that there is thrombosis in the LVAD device, and this is nicely seen with cardiac CT. So the final word or the take-home message that comprehensive evaluation of heart failure is possible with cardiac CT, irrespective of its etiology. And cardiac CT provides guidance for interventional procedures for heart failure. Thank you.
सर एक्सीलेंट प्रेजेंटेशन एंड वेरी नाइस इमेजेस. आपके लिए एक सजेशन है, आप ना एक एटलस बना लें सीटी का ऑनलाइन, तो वो रेजिडेंट्स के लिए बड़ा हेल्पफुल होगा, हम सब के लिए हेल्पफुल होगा इनफैक्ट. तो बिकॉज आपके पास जो कलेक्शन है ना इमेजेस का वो बहुत ज़बरदस्त है, तो आई वुड सजेस्ट कि यू शुड मेक एन एटलस, ऑनलाइन एटलस ऑफ कार्डियक सीटी इमेजेस.
वो आपकी बात से एक बात याद आ गई. वो बांग्लादेश में एक शायर थे, तो वो उनके गवर्नमेंट ने सोचा कि इनका ना एक मुजस्समा बनाना चाहिए. तो उनको एक किसी ना वो किसी क्रॉस पे लगाएंगे. तो उनको जब वो प्रपोजल पेश की गई तो उन्होंने कहा कि मैं खुद ही आके खड़ा हो जाता हूँ उधर. तो आप जहाँ क्या कहेंगे मैं वहीं खुद जाके खड़ा हो जाऊँगा, आप फिक्र ना करें. थैंक यू.
السلام علیکم سر، میرا ایک کوشچن تھا آپ سے. آئی ایم ڈاکٹر عتیم محمود فرام آغا خان یونیورسٹی ہاسپٹل. سر مجھے پوچھنا تھا سی ٹی ایف ایف آر جو ہے تو اس کو پرفارم کرنے کے لیے ہمیں ایڈینوسین یا کسی اور چیز کی ضرورت ہوگی؟ اسے ہم جو کنونشنل ایف ایف آر کرتے ہیں تو اس میں ہم چیز یوز کرتے ہیں، اس میں ہم انسٹنٹینیس فلو نکالتے ہیں، تو اس میں کسی چیز کی ہمیں ضرورت ہوگی یا پھر ایسے ہی ہم نکال سکتے ہیں ود دا ہیلپ آف سافٹ ویئر؟
نہیں، اس میں کسی چیز کی ضرورت نہیں ہوتی. جو نارمل آپ کا ڈیٹا ایکوزیشن ہے ویسے ہی ہوتا ہے، بٹ اٹ شوڈ بی گڈ کوالٹی ایگزام. اس میں آرٹیفیکٹس نہ ہوں، ٹھیک ہے نا، کارنری بلر نہ ہوں، کنٹراسٹ ٹائمنگ ٹھیک ہو، اور تھوڑے سے کلینکل ویریبل ان کو چاہیے ہوتے ہیں. شاید پرابلی بلڈ پریشر چاہیے ہوتا ہے، ہیمیٹوکریٹ چاہیے ہوتا ہے، اور تھوڑی سی انفارمیشن چاہیے ہوتی ہے. وہ جو ہے نا اس میں کوئی ایڈینوسین، کوئی ویزو ڈائلیٹر کچھ نہیں چاہیے ہوتا. اس کی وہ جو ہے نا وہ کلاؤڈ میں ہی پروسیسنگ کرتے ہیں موسٹلی. اور جو ہے نا وہ اس میں فلو ڈائنامکس کے پرنسپلس کو یوز کرتے ہیں، تو اس کے بیسس پہ وہ ڈیسیجن کرتے ہیں. اس میں کئی ساری چیزیں، وہ پلاک کریکٹرسٹکس بھی یوز ہوتے ہیں. اس میں لیومن کی نیروئنگ جتنی ہے وہ بھی دیکھتے ہیں. جو ڈسٹل کنٹراسٹ ہے اس کی ڈسٹریبیوشن امیڈیٹلی آفٹر دا نیروئنگ یا اس سے کافی ڈسٹل کیسے ہے، اگر کیا اس کا ریٹروگریڈ پیٹرن تو نہیں ہے. ایسے تو نہیں ہے کہ فار ایگزامپل ایل ای ڈی ہے، اس میں بالکل ڈسٹل موسٹ پورشن میں اگر زیادہ کنٹراسٹ ہے اور پروکسیمل میں کم ہے، تو اس سے مطلب انڈائریکٹلی آپ انفر کر سکتے ہیں نا کہ پروبلی ریٹروگریڈ زیادہ فل ہو رہی ہے. تو اس طرح کے بہت سارے پیرامیٹرز وہ اپنے سافٹ ویئر یوز کرتا ہے، تو اس سے وہ انالائز کرتا ہے. اس میں کوئی نہ وائر چاہیے، نہ کوئی اس میں کیتھیٹر چاہیے، نہ اس میں ایڈینوسین چاہیے.